produced by infusion of IL-1, that is thrombocytosis. Okay. So if you see the options, fever is done by infusion of IL-1. It is seen by the infusion of TNF alpha. Okay. Now, for a hyperdynamic circulation. Okay. So that is a basic difference and among the interpretation. Now coming to the tag. So we have asked regarding what does each component specifically you need to be aware about tag. If this R time is increased, if the time it's taking more time to form the fibril, awesome, and NSQIP. Okay. Ectomy 25. There are, it is given very